Brilliant. Thank you ever so much, everyone, for joining us today. And it's a lovely sunny day out there. And it's great to have so many of you joining us for our first real Insight Programme webinar this afternoon. My name's Annette Tan. I'm a clinical academic professor of nursing, and I'm the lead of the NHR Insight Programme for the North East North Cumbria. So very much welcome to you today. The Insight Programme is for all health and social care students and professionals at a really early stage of their career, helping to equip them and their, with skills and training to undertake research and combine research with practice. And the aims of the webinar today are to showcase really some of the research landscape across the North East and North Cumbria, and to hear about the research environments and some of the infrastructures that we have to help you as researchers, but also look at some resources available to you. So I'll go on to the next slide and we'll kind of quickly go over what we're going to cover this afternoon or this in the next hour. So we've got a lovely introduction to the NHR, and I'm going to show you a quick video around that. And then we're going to go over to Nina and to Amy from the Newcastle Health Research Partnership to talk about their work. And we're then going to be passing over to Nikki, who's going to talk about developing your research capacity and capability in your organisation. And then we've got Ashley from the Research Support Service coming and talking about supporting academic research across the region. And then at the very end, we've got some exciting opportunities, funded opportunities that we have for with our part of our Insight programme to share with you. So we'll be doing that at the end. I'm sure you'll have questions as you go through, so please put them in the chat function, and what we'll monitor those. We'll let the presenters present their slides and do their bit first, and then we'll come to the end as a little bit of a panel to go through any questions that you've got. But please, as you go through, any questions at all, put those into the chat. So without further ado, let's move on to the introduction to the NHR. And Sean, if you wouldn't mind playing the video for me, please. Let's see if we can get that sound on that. I promise we tested it before it was working. Joys of technology.
Of scientific progress, thinking, testing, learning. Unlocking the answers to healthcare challenges begins with asking the right questions. Over the years, research has achieved amazing things, spurring giant leaps forward in the prevention and treatment of heart disease and cancer, and driving a sharp reduction in child mortality. UK research led the world in rapidly creating the vaccines and treatments needed to combat COVID and return our precious freedoms. But we still face many challenges: mental illness, an aging population, unhealthy lifestyles, health inequalities. Research is needed now more than ever. Answering the call, the National Institute for Health and Care Research is investing in the research required to tackle these urgent issues, enabling the brightest minds to bring their ideas to life. Providing the evidence that policymakers and health and social care professionals need to make the right decisions. Helping to improve the quality and organisation of frontline services. Attracting investment from companies across the world. Training the research workforce of tomorrow. And with research that reaches far and wide, we are helping developing countries to strengthen their health systems and improve the lives of their poorest people. We work with national and local government, the NHS, universities, industry, charities, and most importantly, patients and the public, who influence and enable everything we do. Together, we're transforming lives. NIHR, improving the health and wealth of the nation through research.
Brilliant. So that gives you a really lovely introduction to the NHR, and the Insight programme that we were talking about today is funded by NHR monies. So we're delighted to be part of this big kind of like family. And I'm delighted now to hand over to Amy Brown, who is our Newcastle Health Research Partnership Academy manager. Over to you, Amy.
Thank you, Annette. I feel a bit intimidated following that that video. Here we are. Nice to see everyone this afternoon. So I'm Amy and I manage the Newcastle Health Research Partnership Academy. And Nina's going to cover more of what the Academy is after me, but really our role is to help take you from where you are now in your research career to where you want to go. But today I've been tasked with trying to help you navigate the local research landscape and thinking about what is research infrastructure and where do I fit into it. So over the years, I've had lots of conversations or been in lots of talks about infrastructure, and they kind of tend to go like this, I've noticed. So the sort of textbook definition from NIHR about infrastructure is it provides research expertise, facilities, workforce and support services, and helps deliver the research that the funders fund. So this is an NIHR quote, but it's the same for other infrastructure as well. So we tend to start off like this, and then we'll get maps with circles on showing that we've got a lot going on in Newcastle. And then Jan? And then we very quickly get to key infrastructure. And then this is where the world of acronyms comes in. And these are some acronyms that you'll hear bandied about quite a lot. And because our funders are very good at changing names as well, when we get to the Health Technology Research Centre, what you'll often find is that people start with, this was the DEC, and then it was the MIC, but now it's the HRC, actually. And so these are core NHR ones. And then we remember that we've got other funders that fund infrastructure as well. So we get a whole load more acronyms and names. And then just because we're inclusive and we need to include everything, then we move on to something like this. And you can see very quickly that we've got a lot of names, a lot of text. Some of the names actually are quite helpful in telling you what they do. Some of them less obvious. And before you know it, you might just feel like this. That you haven't got a clue, you don't know where to start, you don't know which way to go, and quite frankly, you might as well be in a different planet. So my job is to try and help demystify some of this a little bit if I can. And what we often do in research, because it works so nicely, is that we talk about journeys. And so we might be talking about the research journey itself. So that might be how the research gets from bench to bedside, for example, or we might be talking about a patient's journey, or we might be talking about your career journey. So I'm just going to stick with the analogy of transport and journeys, if I may. So the NIHR break down infrastructure into this. But as I say, it works for different infrastructure as well, different funders. So we have the translational research. So that's where research is supported to be developed and researchers are supported to conduct their research. And it's translational. So you may have heard of the translational pathway, which we often talk about from bench to bedside. But also we like to think about fell side as well, because we don't want people to be poorly in hospital. We want them to be out there living their lives. There's a set of infrastructure, which we refer to as delivery. This is around the workforce, and it's there to deliver research on behalf of others. So think about clinical trials units, CTUs, clinical research facilities, and the research delivery network. The support infrastructure, and that helps you build your competitive funding applications. That might be the research support service, for example. And then finally, we have the collaboration infrastructure. So this is a way of collaborating with others and across the infrastructure. And a good example of that is the statistics group, for example. But just for now, I want to concentrate on the translational infrastructure because I think that's where you'll most easily see where you fit. And I think where at this stage you can get the most benefit from. So all these other infrastructure do exist. Please have a play on the NIHR website and on our other funders' websites. But I'm just going to chat a little bit about the translational infrastructure and try and explain what that is. So translational infrastructure is there to support researchers. So it's there to support you develop and conduct your research. And really, when we talk about infrastructure in this way, what we're talking about is just a really big grant. And I like to think of these as like a train. So we have a train. We have a driver. We may have multiple drivers, but there's somebody that's helped coordinate the bid, write it, and that leads the train, if you like. And then we have a different number of carriages, and these carriages are like the research themes. So I've used an example here of one of our translational infrastructure that's hosted in Newcastle, and it's the Patient Safety Research Collaboration, or the PSRC. And so here you can see that the PSRC has got 4 different themes, and it's got a capacity building theme, which means that it's also there to help develop you and researchers. And there's different opportunities for you to take part in the PSRC in terms of gaining funding, experience, and so forth. There's these different research themes, and then underpinning all of it, like the track under the train, is PPIE. Move on, please, Sham. And so if you think about these research themes as the different carriages again, you can stay in your own carriage and you can chat with the people there, develop the group there, develop your research interests within these different carriages, or you can move between the different themes. So if you think about your research and your research interests, you might see that actually they exist in polypharmacy, for example, and in data and AI. So it's about building teams with similar research interests, and you can move between those. Next one, Sham. And so if we think of the different infrastructure that we've got, basically these are all just different trains, but it's a similar thing. They've all got somebody leading them at the start. They've all got a driver. They've got teams. They've got different carriages, different numbers of carriages, because some infrastructure like the ARC, for example, that we host in Newcastle by CNTW has got many, many themes, whereas the BRC has got a few less themes, and the PSRC, as I just said, has about 4. But all of these are hosted within Newcastle. They all have a driver that leads them. They all have capacity building, and they're all publicly funded, and they're here in the north. So please, when you get the slides, click on some of these links and have a look around and see if you can recognise where you might fit in and where your research might be. So on the next slide, please. So if we go back to that first map that we showed earlier with all the circles, hopefully it might make a little bit more sense now, because those circles are just different infrastructure, different platforms, different ways of moving your research journey along. And you can see from this map, so this is one that NIHR have made themselves, and they use quite a lot in their publications. It's a bit out of date actually now. We've got more than on here at the present, but you can see that there's circles all over the country. So we've got it all going on in Newcastle, but as soon as you're part of one of those infrastructure in the North East, you are part of a network across the entire country. So if you are part of the PSRC in the North East, you are part of the PRC network, and so forth. So just know that we've got a lot going on, but also we're connected to the rest of the country. Next one, please. So infrastructure, please take away messages. They are not closed shops. They are not private parties. They are publicly funded transport to help you move your research along. So get out and train spot, subscribe to the email lists, the LinkedIn accounts, and so forth. Get your ticket when you're ready and join in and see how you can benefit from the research that is funded locally, and enjoy it. It's fun. Right, next slide, please. So I'm going to hand over to Nina, who is the Deputy Director of Newcastle Health Research Partnership Academy, and she's going to tell you more detail about what we actually do in the Academy and how we're here to support you. So hand over, Nina.
Thank you, Amy. And that was just a brilliant presentation. The infrastructure can be quite head-spinning, but hopefully Amy has made it really clear for you. And it really is, it's sort of open door. You don't even need to buy a ticket. You just need to get to the station and see what trains are going, and you know, just jump on. I'll be talking very briefly about the Academy. So the infrastructure covers all kinds of research activities, including, like Amy said, capacity building. The Newcastle Health Research Partnership, we focus on the capacity building. That is our bread and butter. And, you know, building on Amy's analogy, what we try to do is to be kind of the hub for all those capacity building train drivers, carriage managers, so that there's connectivity across the different types of infrastructure. whoever that's funded by, but the capacity building activities and the ways to support people's careers are connected and that we're sharing good practice. Next slide, please. So we work across the region. We very much emphasize the kind of connectivity and connections, and we work in partnership. So at the bottom, you can see the sort of core partners who are putting funding into the academy, but actually our reach is very much across the whole North East and North Cumbria, because you just need to have some kind of connection to one of the partners, and then you're part of the gang. So like with the trains, like with the infrastructure, there's no ticket needed. You don't need to have any money. You can just come and start to get involved in the activities. Amy's the academy manager. We've got quite a lot of different activities going on, some that are led by our members. So equally, if you've got good ideas that you want to do, Annette leads the nursing, midwives, AHPs, psychology, pharmacy, and healthcare sciences pillar. So a lot of people are involved, and it's really about that kind of ensuring connectivity. So wherever you are, whichever platform you're on, whichever train you're traveling with, you can be connected and you can have that access to support. Next slide, please. And our emphasis is very much on sort of working with people across the career pathway and looking at how can we support you to become the future leader or to continue to grow your leadership. Looking at what's the cutting edge information, intelligence, what's happening in the national landscape. What can you know, what levers can you pull that helps you to do what you want to do and helps you to connect to sort of strategically important activities, and really kind of use the different escalators to speed up rather than get stuck with difficulties. Next slide, please. Our work is connected across the different sort of career pathways, different ways of thinking about what does career even mean, right? Most of the time when we give talks, people are like, oh, but I don't really think about career. I'm doing my job, you know, I enjoy my role. I'm doing this because I want to help the people or because I want to find better ways of doing things. And we use the career in a very flexible way. We mean a lot of different things. It just means what you're doing now, where do you want to grow, what do you want to do next, what good do you want to do in the world. And the sort of latest language around that is really the shift towards talking about the workforce. And there's some big initiatives coming down the sort of line, priorities around how do we grow our research workforce capacity. And that means all of you. It means everybody in the NHS, everybody in the local authority, everybody in social care. It means researchers, it means practitioners, it means clinicians, it literally means everybody. And the sort of shift in conversation from just the people who do research and know all the methods to people who are research aware, to then people who are doing research and people who are leading research. And actually all of us can play these different roles in different settings and in different sort of topics. Next slide, please. And this is just to emphasize that we really work across the whole career pathway. So I believe most of you are still at the sort of reasonably start early on in the career pathway, but we are here to support people across from undergraduate to the sort of pre-doctoral research experience, doctoral, doing PhDs, to then beyond that to postdoctoral and all the way to leading your own research, being at that cutting edge of your field. Next slide, please, which I think might be the last one. That's it. So that's our kind of motto. The door is very open. The door is always open. If you've got questions, if you want to chat about things, we've also got a survey running and Amy has put a QR code there. So please click on that and just give us a bit of information about your sort of needs, where you are and what you're thinking. And that helps us to improve our support as well. So I'm handing over to Nikki and wishing you a very happy growth journey.
Thank you, Nina. Hi everyone. So I'm Nikki Cunningham and I'm lead for nursing, midwifery and allied health professional research within University Hospital Tees, which is South Tees Trust and North Tees and Hartlepool Trust. And I want to talk to you today about developing your own research landscape, which hopefully will help you grow your capacity and capability yourselves in whichever profession or area you're in. Next slide, please, Sean. So we talk about a smorgasbord, but we are from the north, so I've gone with buffet. A buffet of things that you can select from that hopefully can help you think about how you develop in whatever area you are, wherever you're situated, and whatever placements that you might go on or areas you might end up working in. Next slide, please. So first off, I just wanted to talk about exposure. So raising that awareness of what's out there. So if you're in a ward, a department, a unit, a local authority, wherever you are within your profession, it doesn't mean to say that research is not going on if you're not seeing it. A lot of the time it can be very behind the scenes, but there may be some information out there. So seek out that information, seek out notice boards, go on the organisational's intranet pages, search for research, and I think you'll be surprised at how much is actually going on and how many links there are across the region and across that infrastructure and what support's out there. Look for signs of research activity, whether you're on placements or whatever area that you work in, and ask around and see who you can reach out to get those links within your own areas. Seek out your research and development department. A lot of people don't know where it is. It could be called an R&I department. Go and see them. They'd love visitors. They love the fact that people are going in and asking about what they do and how it works within all different types of organisations, wherever you're situated. It could be a small department, one or two people. It could be quite large. I think you'll be quite surprised. So go and seek out, ask for a visit, ask to speak to somebody. And ask about research or evidence-based practice groups that are within your areas. Usually there is groups that you can join, whether that be in profession, whether that be in the specialty that you're interested in, or whether that's organisational wide. So ask about those groups. Next slide, please. Try and engage with what's going on there. It's really lovely when we get people that really do want to be involved with research and want to help out. So see what's happening in those areas. Link up with any research delivery teams. Amy mentioned about delivery. So they're the workforce. They're your research nurses, midwives, allied health professionals and clinical research practitioners and coordinators that are out there delivering the research within the organisation. Try and link up with them. If you don't have any in your immediate area, look at something a bit wider and see if you could get to spend some time with them. And think about your support services that are out there. Services like pharmacy, imaging, pathology, they're all involved if there's research going on, and they'll all have people that will want to speak to you and to be able to tell you about what they do to support research and how you can be aware and get involved in that. And don't forget about your library services. Even if they're not the university ones, reach out to your library services. They are invaluable. We're going to go through lots of opportunities within the SeedSite programme, but there's lots out there already as well. So think about what education opportunities are there. It could be webinars such as this, short courses, some virtual tools that are out there. The 4Ps Lite, that's going to be available to you again in, I think it's June, and you'll get some more information at the end of this webinar on that. There's internships and vacations coming up. There's another webinars series that we're going to continue from this in July, and then there's the master's studentships, but there's also a lot of stuff out there on an IHR Learn, on the Roots to Research website. There's so much information. Do try and get some time to just explore this and see what could fit you. Next slide, please. And when it comes to embedding that within your day-to-day role, it's about building your own research network and your own support what's around you. And that could be immediately locally, as well as regionally and even nationally or even internationally. But try and build your own research networks. Look for professional groups, research groups that you've got around you. Join your newsletters, your mailing lists, so that you're aware of the opportunities that are coming. And there's a multi-professional practice research capabilities framework. It rolls off the tongue, that one, doesn't it? We need another name for it. Available now as well, that can help you figure out where you are as a starting point and where you want to be, all the way from entry level through to consultant level. And we will be doing a webinar on that framework itself as well to help with. But utilize these tools to be able to see where you can go next. Give that bit of guidance. Next, please. And at the end of the day, we're all leaders at no matter what stage we are within our careers. And you can be leaders within research. You can be that research champion. You can volunteer or suggest things and get other people involved. You can be that link with the research delivery teams and encourage and enthuse others by sharing your knowledge and sharing that learning. You can become that educator. You could be the one that be doing the presentations and the publications. There's so many research awards or conferences aimed at students and early career professionals. So, you can be the ones to do that and become that research leader. But I think it's about utilising these resources, and there's resources of how to be now a matron or a clinical leader. There's toolkits and things out there. So utilise those and be that leader in research, and you'll be surprised of who wants to come on that journey with you. You'll soon increase in size, I'm sure. Next slide, please. So to help with this, would you got some top tips for developing your own research landscape? There's many I've mentioned here, but there's a lot of links, as in with a lot of our presentations, we can signpost you to lots of areas where that can help. And this, I believe, can be available to you after this webinar. So please use that, have a go on some of those links and see what fits for you. But be aware this is by no means exhaustive. There's so much out there, but it may be a starting point. So I think that's me. I'm now going to pass you over to Ashley, who's going to talk about the Research Support Service. Over to you, Ashley.
Thanks very much, Nikki. So my name is Ashley, and I'm one of the methodological advisors who works for the Research Support Service at Newcastle. So you've heard a lot of really interesting advice about, building the way you want to build your projects and your research areas and your collaborations. But it can be a bit difficult translating that into a grant application. So you look at the first time you pull up an NHIR page with the grant application, it can be a bit of a maze to get your idea onto a good application. And this is where we can help. We can help you get your idea into the best possible application for funding so that you can carry it out. Next slide, if that's okay. Perfect. So good place to start is, what is the Research Support Service? So if anyone used the Research Design Service before, this is a sort of new iteration of that. I can't remember who said that the NHIR loves a rebadge, and this is no exception. So what the Research Support Service does, it's a national service funded by the National Institute for Health Researchers to help you get the support you need to make a really good funding application. And we'll go through all the different things that we can do to help as we go through. Now, in the UK, there are 8 hubs for the Research Support Service. So they have a kind of named university, but they're usually a collaborative effort. So I work for the Newcastle hub, and we collaborate with Durham and Northumbria and Teesside. So none of these groups will work in isolation. There will always be lots of expertise to draw on. And some of the centres are specialist centres, meaning they have a special interest in a particular kind of research. So between Newcastle and Southampton, we have an interest in public health. Lancaster is a specialist centre for social care, and King's has a special interest in mental health and brain disorders. So that's the kind of landscape. I will say that you do not have to go to the specialist centre to approach your RSS about a particular kind of project. So, for example, at Newcastle, we have a lot of people who are interested in social care, even if it's the specialist centres at Lancaster. So you can approach any hub that you like. People tend to go to their local one, but yeah, so we have 8 throughout the UK with a few specialist centres. Next slide, please. So who can we support? Well, most people can get some kind of support from the RSS. So if you are planning to apply to an open and peer-reviewed funding programme, it doesn't have to be a funding programme from the NIHR. We can help with things like the MRC or charitable grants as well. Then we can help you. It does have to be an open competition, meaning it can only apply to certain people and it has to be peer-reviewed to some extent. But most funding pots that you will apply for will generally meet this criteria. We can also help you with things like development awards. So it's not just projects and studies that we can help with. You know, we can help design fellowships, PhD awards, development grants, things to help you as a researcher develop rather than a specific project. And generally we help researchers who are working within England, or if you're someone in the devolved nations, so Scotland, Wales or Northern Ireland, if you're teamed up with an English partner, we can help you there as well. The only people, unfortunately, we cannot support are researchers who are outside the UK, unless, you know, it's a co-applicant on a UK-led institution. Unfortunately, global health is a little bit outside of our remit. There are other ways you can find support, but we are generally looking for projects sort of looking at the UK, and we cannot help with anything involved with animals or animal tissue. So those are the only people that we specifically are unable to help, but anyone else can approach us for support. Next slide, please. So what's the benefit of approaching the RSS? So our role is to improve the overall quality of research submissions. The reason that the RDS came to be was that one of the funding streams was finding that their applications were kind of variable in how the quality of them. So essentially they wanted to have a service to help people kind of plug these gaps to make them very good applications. And it started with one funding stream and now expands to all. And what we can do is provide you with access to a range of methodological experts. So you might have a great team around you, but you might need some help with, say, a statistician or an epidemiologist or some kind of methodological expert. And we have a really wide berth of methodological experts in the RSS. So we can basically get advice for you from one of them. And when you join us, you will request help from us rather, you will also get a general methodologist who will just revise you on the process and will stay with you through the entire process of the RSS. So you'll always have a named person to go back to. So my particular method is health economics, but there's projects that I work on just to kind of advise on the overall journey of the grant application and arrange meetings with other methodologists, even if this isn't a project suitable for health economics. We have a team that have held many research grants, that have sat on funding panels, that we try and get opportunities for those who work here to shadow funding panels. So next month, I'm going to be going to view the RFPB, the Research for Patient Benefit panel. So it gives us a real idea of what a good application looks like. So this is a lot of expertise that's available for you to tap into to help build your application. Next slide. So what we can do for you, as well as kind of arranging meeting with experts, is we can discuss appropriate funders. So people worry that they need to come to us with something really, really firm, you know, in hand, which isn't the case. You know, the earlier you come and see us, the better. So we can help advise you what might be a good funder for your project. So as I say, we have a lot of expertise with people who've applied to different funders. So we've got, you know, health technology assessments or research for basic benefits. So we can help you pick the right funder for your work to get it funded. And when your draft application is ready, we can offer things like peer review. So that could be two, you know, general methodologists who would sort of be trying to read from a panel member's perspective to offer feedback. Or if you have, for example, an application with a lot of qualitative elements, we could ask for a specific qualitative researcher to look at your application as well and give feedback. Another thing we can do is actually mock interviews. So if you are applying for example, one of the fellowships, like the doctoral fellowship or the advanced fellowship, this will include a panel interview, which can be quite a full-on panel interview. So we can give you a few mocks to get you ready. So these are all things we can arrange to help you get through the process. Next slide. We've got a really good team that can offer PPIE support. So it was mentioned in one of the previous presentations that patient public involvement and engagement is a key part of research. Historically it was seen as nice. Now it's absolutely essential for any bid going in, particularly to the NHIR, which is great because PPI projects with good PPIE are better. They recruit more, they retain more. So what we can do is we have methodologists who are experts in using and working with PPIE members. So they can help you come up with a really good PPIE plan. And I would advise speaking to them if you get in touch with us, even if you have a group there already or you've started some work, as they can still help you get your plan and your groups organised. The RSS actually has its own public panel, so we've got members of the public who can also give feedback on applications, and where they're really specifically helpful is things like the lay summary. So people sometimes don't realise how important it is to have your summary in lay language be very, very clear, and they can help you with that. And also just they're very good at making you put across the value of the research. Having to explain to a lay panel is a really useful exercise in making sure you know what the best parts of your research are. And there's also, if you get a broad package of PPIE support, small pots of money that can be applied for to run a group. So there's lots of benefits from kind of using that support. We also have now got members to discuss equity, diversion and inclusion. So this is now a priority for the NHIR to make sure that both the project and the team have issues of EDI have been addressed. So this is something we can advise you on too. Next slide, please. So how to involve us? So as I said, the sooner you get in touch, the better. Don't worry if you don't have every, T crossed and I dotted. As long as you've got the outline of an idea, you can get in touch. So if you go onto the NHIR website, you'll find a contact form like the one below. So this is the one for Newcastle that's going to ask you just some basic questions about you and the project that you want to do. So the sooner you get in touch, the better. Next slide, please. And the first thing that will happen is you will get what we call a research cafe, which unfortunately does not happen in a cafe, but it's a 30-minute meeting where we just get an idea of what we can do to support you. So we basically can decide here what we can do to support you if you can. So the very rare instances where we can't support is generally if a deadline is too close. So things like a couple of weeks before deadline, it's very difficult for us to kind of be able to arrange help, but anything before that, we should be able to find something to help. And we can arrange these further meetings that we've discussed once you've met your primary methodologist. We can click again, and we can start meeting with the public members to sort of see when that's going to take shape. And then peer review can be arranged after that. One thing I will say again is be mindful of timescales. So occasionally we do have someone who kind of expects maybe to meet the first member on the Monday, the statistician on the Tuesday, and the epidemiologist on the Wednesday. These are often busy people, so we just need a little bit of time. So factor this into your project plan that you're going to need a little bit of time to meet all these people to advise on your methods. Next slide. So not to finish on a negative, but just to kind of say a couple of things we cannot do for you. This one may seem obvious, but we cannot write the application for you. We can advise and read it, but we cannot write it. We cannot do costings for you. So this is where being in touch with your research office is really good, so that you can basically have your idea of what your finance team who are going to support you. We can't really drive the application. That's got to come from you as the clinical expert. You can kind of push things forward. We're obviously happy to meet regularly, but it is your project and we're just there to support you. And we cannot generally provide clinical topic experts. So this is where your networks come in. So these are the people around in all your other networks. Our support is where we can plug the gap for methodologists. And last click here, we cannot guarantee co-applicants. So it can happen where someone that you meet through the RSS is a good fit to join your grant as a co-applicant. And that does happen fairly often, but it's just not something we can guarantee. But aside from that, everything else is open for us to support you. So happy to hear any questions, and I'll pass back to Annette for the Q&A.
Thank you ever so much. That's been a really fantastic overview from Amy and Nina, Nikki and Ashley, looking at not only the national picture, but also we've got regionally. If anybody got any questions, please put them in the chat or put your hand up. I don't think there's that many of us today, so feel free to come on if you've got a question. Nikki, can you remember how you got started in research?
Mine was quite some time ago now, coming up 3 decades ago. But I was working as a staff nurse in cardiovascular, and I wanted more of a specialist role. So I took the opportunity where we were one of the first departments in the trust to have the opportunity to be a research nurse. So I started very much in delivery, and I've done delivery on and off for many years in different guises. And yeah, that was it. And I've worked within an element, apart from 3 months, I think when I moved to Australia, I had 3 months where I did a different role, and then I went back to research because it was definitely my thing. But otherwise, yeah, I think about 28 years later, I'm still working in research, but hopefully trying to encourage others. But yeah, a lot of us in those times sort of fell into it a bit. Whereas
Yeah.
there's a lot more opportunity to get involved in different ways now. So a lot more different career paths that you can take that involves it.
Definitely. It's amazing, isn't it? I think what's available these days compared to what there was even just 5 years ago. Amy, have you got any reflections on the kind of that early career stage in research and any advice?
I think it's really exciting that there's opportunities for everybody to get involved in research earlier in their careers. We've been fortunate for some time now that medics and dentists are able to integrate research into their training, and that hasn't been the way for other professions. So now that it is, I think grab the opportunities. So, programs like Insights, who are here to, provide funding for masters where possible, internships, and, being able to develop your clinical career alongside your research career is just so exciting, and grab the opportunities, I think. But don't be scared either. Chat to people. I think it's quite difficult to, sometimes it can be difficult to feel like you're part of that team or this is for you. And I just, really want people to know that we've got a lot going on up here, but they're not private members clubs. Everything's publicly funded and you're here because you're interested. So it's here for you as well. So join in and come chat. That's something that we really like to do in the academy, chat to people. So never feel afraid to come along and chat or turn up to a meeting or an event and just talk to people and network.
Thanks, Amy. And actually, have you noticed within your role any more NMAPs coming through, looking for grants, rewards or support, in the last few years compared to previous times?
Well, I'm quite a new member of the RSS, but certainly I think that a lot more people are feeling more confident about going for their first grant, which is great, and I think it's not something to be afraid of. I know when you click on the page, as I said, when you look at the research application, your heart can sink because it's however many pages long and it has a million acronyms, but it's really easy. All you just need is one person who's done it before or a service like ours to just help you break it down. And the funding seems huge until you just break it down into sort of smaller parts. So I think it is really good that we're seeing more varied professions. As you say, I've seen more kind of allied health professionals rather than it just being, medics or dentists or people who've historically been involved in research. And I will say there are now specific calls. So if you're an allied health professional, funders like the Research for Patient Benefit actually have a call, admittedly a bit late because the next one's next week, but they have specific calls that only allied health professionals can apply to, or some of them are nurses that can apply to. So keep an eye out for those, or sort of stay on mailing lists if you can, because there are specific calls for you that people will be looking for.
Thanks, Ashley. We've got a question that's come through from Kath. Thanks for putting that in the chat today. So you're saying, do you have any suggestions of similar organisations that would deal with research in Southern Africa? I have a good few years to go, but would love to do some work in that region at some point in my career. Amy or Ashley, do you want to take that one?
So I'm just wondering, Kath, what you mean by deal with research in Southern Africa. So there are lots of funders that will fund research in other countries, and NIHR definitely does have a global research program. Some of those programs are currently targeted to more advanced career stages in terms of the personal awards. So there's a global research postdoctoral fellowships and advanced fellowship and professorship, but there are grants and certainly networks and research funding available for research in other countries. And so you will be able to get support for those locally. The RSS may not focus specifically on supporting overseas research, but most organisations do have funding development teams or similar titled teams. So I know, for example, Newcastle University has a team that would support that. Northumbria University does, and I'm sure others do too. So I'm just not quite sure what you mean by deal with, but certainly in terms of funding, yes, there are organisations that will fund that, and you will be able to access support. And coming back to how complicated the landscape looks locally, it does look complicated, but most of us know each other where we're parts of that infrastructure. So if you get in touch with any of us and we're not the right place to help you, we will do our best to pass you on to the best place. So reach out and get in touch with any of us and we'll do our best to get you to the right place. So I hope that's helpful, Kath, and how exciting. Good luck with your research in South Africa.
Thanks for that, Amy. Great, lovely. Okay, then let's have a look at some of the funded opportunities then that we have within the NHR Insight for the North East North Cumbria. So I wanted to start with the eligibility criteria, really. So with our Insights Awards, we are able to fund individuals who are registered healthcare, social work or public health professions at an early stage of your career. And by that we mean somebody who's within the first 5 years of post registration or regulatory, where they've signed up for the regulatory body, or whether you're an undergraduate and you need to be working in the North East or North Cumbria, and living up here. So you'll see on the right hand side of your screen there's a whole list of regulatory bodies that we can cover. So you've either got to be training towards one of those or registered with one of those regulatory bodies to be eligible for our funded opportunities. Obviously, anybody can come along to our unfunded things like today with the webinars and the other events that we've got, but for the funded opportunities, you need to be, I said, either registered or working towards one of these regulatory bodies, and either a student or within the first 5 years, or, excluding career breaks of your career. Next slide, please. So to start us off, we've got the first thing is called the 4Ps Light. And this is just like a 3-hour session that we've got that talks really through kind of understanding research, and it goes through the person, place, project and plan. There is a larger 4Ps program that's done over a longer period of time, but the 4Ps Light is kind of a condensed version of that. And what you'll see is we've got the next course available on Thursday, the 5th of June from 9:30 to 12:30. It'll be delivered on Teams, and we've got the QR code there for you to scan into to have a look for. So if you just want to have a little bit more information, a little bit more time, a little bit more chat and interactivity around that, then please sign up for that. Again, this is a funded place. So there is usually a cost attached to the 4Ps Light, but if you're registered as part of Insights and you fit the eligibility criteria, then you can have this place funded for you. So please have a look at that. There will be more opportunities for the 4Ps Light throughout the year, but I said our next provision, of course, is for the 5th of June. So it'd be great if you want to kind of sign up for that. I said it's a really nice next step on a little bit more information about yourself and your career. Next slide, please. The next really exciting thing we've got is our internship. And this we're really excited about. This was just launched in the last couple of weeks. And again, this is for, we're launching this for students. So if you're still a student with any of the universities within the North East or North Cumbria region, you'll be eligible to apply as long as you're, I said, working towards one of those regulatory bodies. And we're suggesting that if you've been in your second or third year of study, they could apply for these. We've got 3 options open available to students. So we've got a research vacation internship, which will be conducted over the course of the summer holidays, for example. We've also got a research delivery internship, and we've got a research assistant internship. These are all kind of fully funded placements for you, with opportunities to kind of work with a research team over a number of weeks or a number of months that you might know about, or even to dip your toe into research, and we can kind of like help provide a bespoke program for you for an internship, looking onto panels. Ashley's talked about shadowing opportunities, kind of meeting other individuals, meeting, different research teams, just to give you a much better idea about what research is all about. And as I said, this is just a really lovely chance to be able to dip your toe into the water and to find a little bit more about it, and what could be happening, both in terms of research delivery or even think about a clinical academic career. Our internship opened I said our intern is open in a minute, and then the deadline to apply for that, if you're looking at for a vacation research internship, it will be the 2nd of May. But then if you're going to do it through term time, the deadline for that will be the 13th of June. And I know that Sean's put some more the link in the chat to find out more about that. And there's obviously the QR code. But this is a really exciting opportunity to spend some time with a research team or to learn more about research and be funded to do that. So particularly, I said, focus for students, and hopefully that'll be a really exciting option. It is competitive across the region because it will be covering the whole of the North East and North Cumbria. And obviously we've got 5 major universities involved within this, and there are lots of students across those programs. But please, it's a great chance then to kind of join in and kind of get some more information around that. Next slide, please. We've also got fully funded master's scholarships open and available now. So that application is out. And we've got fully funded or part-time master's places available either at Northumbria University, Newcastle University, Teesside University, or Cumbria University. And you'll see there the programs that we've got on offer on the left-hand side of the screen. I said some of these are full-time, some of them are part-time, some of them are face-to-face, some of the distance learning as well. Again, I said these are fully funded, so all your master's fees are kind of covered. And the other exciting part about this is we also have stipends available. So if you want to study full-time for any of these programs, we have a full-time stipend available, and the full-time stipend is just under £20,000 per year. This is tax-free amount. If you're going to study part-time, you also get potentially a stipend of just under £10,000, and the stipends are there to cover cost of living for you. They're not to cover there for the fees because they're already covered, but we would ask if through that application process. So it does help then to have those opportunities that are funded as well as having your course fees funded, and a fantastic opportunity to look at different masters in research opportunities available to you. Again, I'll show you in a little bit the links to further information regarding this. We have had a webinar regarding our master scholarships with the program leads not so long back, and can again send you that link to our webinar that we had to provide you a bit further details around that. But certainly if you're looking at wanting to undertake a master's program, looking at wanting to be more research active, then this might be something that you might want to consider and have a look at. So please do. Next slide, please, Sean. We have our web site available through the Newcastle Research Partnership, which will give a lot more details as well about our master's scholarships. So please have a look, log into there, and again the QR code's there for you to have a look at, and it provides you with all the kind of the deadlines and the information that you'll need that go along with that. So please have a look. And then next slide. Yep, and we've also got, I know that Nikki talked before about our routes to research. This is a really wonderful resource covering the whole of the North East North Cumbria for all researchers really at any stage. Lots of information in there and support. It's got lots of stories there, it's got lots of training opportunities, it's got lots of links to other webinars, information support. And as part of our Insight program, we're also linked into here. So you'll see more about our research webinar series, about 4-piece light, or internships, our vacation scholarships, and our master studentships. So if you want to find any more information about our Insights program, please head along to Roots to Research and you'll find some further details. That'll be there too. And then next slide, I think. Yep. And again, if you still can't find what you need from us, then please just get in touch. I said Amy's kind of like put the link in before about the mailing list. It's really good really to kind of sign yourself up to find out what's coming through. Often we have lots of other events with know your funders and opportunities to get involved and things about learning about impact. So it's just kind of like helping to dip your toe back into the water again and to find out a little bit more what's going on in the region. There's lots of support out there for you. So please join up to our mailing list and to the websites, and we put our LinkedIn and our links there and our email addresses there for you to have a look at. So yeah, please sign up if you haven't done already. And next slide, please. Thank you. All right. I think there's a couple of questions that's come through there from Julie. And I can